started with our Plan of Care workflow webinar this morning. I just want to welcome again everyone who's joined us on the call. And with that, we're going to get started. So again, I just would like to introduce myself. My name is Meg Beyer. I am going to be one of the presenters this morning. I am a social worker, and I work for ICL in MCTAC. My colleague, who you will be hearing from shortly, is named Alam Elbadou. She is also a social worker, and she works for Casa Columbia and MCTAC. We are both social workers, although our licensure is reflected differently simply because we are licensed by different states, New York and New Jersey. So thank you again for joining us. So as I mentioned, Alam and I both work as part of a collaborative partnership that is MCTAC. Now MCTAC, MCTAC, stands for the Managed Care Technical Assistance Center. And what is MCTAC? Well, we are a training, consultation, and educational resource center that offers resources to all mental health and substance use disorder providers in New York State. So all behavioral health providers, we offer this training, consultation, and educational resources to. The primary goal of MCTAC is to provide training and intensive support on quality improvement strategies, including business, organizational, and clinical practices to achieve the overall goal of preparing and assisting providers with the transition to Medicaid managed care. We have been doing this training ongoing for over the last year, and in a little bit more time, actually. We've done a lot of in-person, online trainings, and I'll talk about where you can find all of those resources in just a little bit. So again, who is part of MCTAC? MCTAC is really part of this collaborative partnership between the McSilver Institute for Poverty Policy and Research, which is housed out of the NYU Silver School of Social Work, and Casa Columbia. And we are really a diverse partnership, a collaborative partnership consisting of all of these partners, both advocacy and provider organizations that expand both New York State and also various levels of expertise. So in the technical assistance that we deliver, we're able to pull from different areas of expertise with our different partners all across New York State. Okay, and before we start on this workflow, I just want to emphasize today that first of all, this webinar will be recorded. It's going to be posted on MCTAC's website, which is MCTAC, MCTAC.org. All of our former webinars, prior webinars, other trainings we've done, other events we've recorded can all be posted, all be found posted there. We have a variety of different resources as well that are there. The other thing that I want to emphasize is that Alam and I are going to walk through the workflow as it is today. As we know, there are many individuals, many care managers out there who are doing the assessments and going through this plan of care process. But what we really want to emphasize is that we know there are ongoing conversations with the state about maybe some updates to the workflow. And if there are any changes, anything at all that happens, MCTAC will be sure to post any updates both to our website as well as to email out to our email listserv. So the final thing that I wanted to encourage everyone this morning to do before I pass along the presentation to Alam is to sign up for MCTAC's listserv. Just about every week we send out information, whether it's upcoming trainings, upcoming events, any updates on policies from the state. I would encourage you to sign up for our listserv so that you can be tied in and aware of any changes or updates that might come. So with that, I'm going to pass along to my colleague, Alam Elbadou.
Thank you, Meg. Good morning, everybody. Thanks so much for joining us this morning. I just wanted to preface this by just reiterating, as Meg said, that this is how the workflow stands as of right now. So I want to make sure that we definitely encourage you to ask as many questions as you need. Feel free to send over those questions in the chat box. What we're going to do towards the end of this presentation is compile all of these questions and hopefully be able to get back to you within a timely fashion with any answers that we may have. And any answers that need further follow-up, we'll definitely make sure to reach out to the proper state officials to help us get the proper information right back to you. Okay, so without any further delay, I want to bring your attention to this slide that we have up right now, which is a pretty busy slide. But I'm hoping that all of you guys have your cup of coffee in hand, as I do, as we work through this. So this slide specifically walks through the individuals who are deemed HARP eligible and are already enrolled in a health home and in a HARP HIV SNP plan. So I want to take your attention to box A. This is the initiation process for an individual who is interested in receiving HCBS services. So the way that's initiated is the health home care manager conducts the behavioral health HCBS eligibility assessment, okay? So if you notice there on the bottom, there are a handful of footnotes. And as I go through the boxes, I'm going to reference down to those footnotes. So step 1 talks about the initial assessment, which the eligibility assessment is in essence a subset of questions from the New York State Community Mental Health Assessment. And this, in fact, can be done telephonically. If we want to continue down the box, if the person is deemed eligible from that brief assessment, the health home care manager then conducts the full behavioral health HCBS assessment. And that, in fact, needs to be done face-to-face. Now, let's say you have a client who's unable to make it, you somehow can't reach them on the phone. The only option is to really get the individual in the office that one time. You can, in fact, conduct the eligibility assessment and the full assessment in the same meeting that will be done face-to-face. The point I want to emphasize here is that the full assessment does need to happen face-to-face. Okay? So moving on to step B, and before I get started with that, what we're doing today is we're actually going to be able to zoom into these steps and get a little bit more granular in detail. So step B is definitely a full box with a lot of information. So what we're going to do is we're actually going to flip to another slide that is almost going to give us a zoomed in version of step B. Okay, and that's what you're seeing right now. So I'm going to quickly just read through the step only because it makes sense to read through it, and then we're going to delve a little bit deeper, okay? So in collaboration with the member and in consultation with providers as necessary, the health home care manager develops a fully integrated plan of care, which includes physical and behavioral health services, and recommended HCBS services including their scope, duration, and frequency, and also selects the in-network providers. Now, on the previous slide, which we'll go back to in a little bit, but footnote 3 really just emphasizes the importance of ensuring that you are giving the individual as many options as possible to receive the HCBS services. So what this really means is that we want to pay attention to what's most convenient for the client, whether it be geographic location, whether it be the services that are actually provided at this particular agency. We want to make sure that we give the client as many options as possible. At the very minimum, we want to give 2 HCBS provider options, and we definitely want to make it a point to notate this on the plan of care because, as we know, documentation is everything, and this is going to be really important for several reasons down the line. To ensure that you're giving the client as many options as possible that makes sense for their circumstances. And in addition, to ensure that you are, following through with the MCO and state guidelines of ensuring that this process is as person-centered as possible. Okay, so we're going to jump down to the second piece of the bigger box in step B, which states that the health home care manager consults with the HCBS providers who recommend scope, duration, and frequency for the HCBS services. At that point, the health home care manager completes the plan of care. Now, as you can see, there's a lot of communication that's needed between the care manager and these HCBS providers that the individual receiving the services has deemed the most convenient for them. So box B1 talks about the health home care manager actually refers the member to that specific provider. So client says that agency A over agency B happens to be more convenient for me. I can actually walk there. Great. That's the provider that we're going to send you to, the one that you've chosen. And at that point, that it should be very convenient to actually walk their way to the HCBS provider's office. So step B2 actually reflects that. So the client makes their way over to that HCBS provider, and that is when that provider does their own specific assessment, which then determines the scope, duration, and frequency. Now, the care manager makes their original, I guess, suggestion, if you may, based off of the assessment that they've done with the client to recommend specific services that they see fit. And then what happens pretty much after the HCBS provider does their assessment is that they either confirm, yeah, you're right, care manager, this does seem appropriate, and you know what else could help our client is that if we tack on this service as well. So it's a collaboration process between the two parties to ensure that the client's needs are fully met. And of course, this conversation entails the client's perspective as well. So we want to make sure that we emphasize that. Step B3 just really loops it all back. Care manager incorporates the scope, duration, and frequency into the final plan of care. So that in itself is the process, the back and forth. Now, I just want to quickly plug that the agency that is actually conducting the the plan of care can, in fact, also be an HCBS provider. Now, you, as an agency completing the plan of care, may very well refer to yourself if it happens to be one of the most convenient options for the client. You want to be, of course, very aware that that shouldn't always happen. You want to make sure if it fits with the client's circumstances, of course, by all means, make the recommendation or give that option. But the client should have full ability to make any choice that works the best for him or her. Okay, and with that, I'm going to pass the baton back to Meg, who's going to walk you through step C.
Thank you, Alam. Sure. So I'm going to just jump back one slide and point out, okay, let's see. So I'm going to point out, so I'm going to be talking about step C, and just like Alam did, I'm going to actually jump a few slides ahead and show you we've broken down step C just a little bit more. So I just wanted to show you where in the workflow we were, and I'm going to jump ahead to step C, which kind of magnifies a little bit more what's going on. So in step C, the health home care manager forwards the fully integrated plan of care to the managed care organization for approval of all physical health, behavioral health, and HCBS services in the fully integrated plan of care. So I think with that, we just really want to emphasize that all services, physical, behavioral, and HCBS are included in the fully integrated plan of care. The MCO will then work collaboratively with the health home care manager and the member to finalize an approved plan of care. So again, this is just really emphasizing the collaboration that's necessary as well as the client choice that is really an important component of this whole process. And then the little box on the bottom, we wanted to emphasize that the authorization and payment processes are separate and apart from the plan of care processes for the state plan services, such as any physical health services and behavioral health services. So really what box C, what this tiny box is clarifying, is that even though all services, physical health, behavioral health, and HCBS should be included in the plan of care, non-HCBS services will not be denied if they are not included. So providers will be paid, authorizations will work. We just wanted to emphasize this for this step. Okay, now I'm going to jump back to that overall workflow for step D. So step D is really about the health home care manager ensuring that the member is referred to the services listed in the plan of care. So what services they've found to be eligible for, that are listed in the plan of care, it's the health home care manager's responsibility to really make sure that the member is connected to those services. Okay, and with that, I'm going to pass along to Alam.
Okay, so step E mentions pretty much the final process, right? So the health home care manager monitors the plan of care and ensures that the member is getting these services that were reflected in the plan of care. Revisions happen when necessary, and we'll actually jump a little bit more into detail to tell you who can initiate that and why they would initiate a change, and what some examples are of some changes that could happen that may require initiation of an update. So, and of course, incorporating the members' input throughout all of this and their choice. And then when revising the plan of care, the MCO is still required to approve it and review it. And at that point, if any changes are made, this just indicates that we would just need to jump right back to box C, where the health home care manager forwards the fully integrated plan of care with the updates to the MCO for approval. Okay.
So with that, I think I'm going to jump ahead to our next workflow. Let's jump right ahead. And this is separate and distinct from the workflow we just walked through, because this workflow is talking about HARP-eligible individuals who choose not to enroll in a health home. So that's the main difference between the workflow we just walked through and what we're about to talk through. So box A talks about the MCO contracting with a health home or another state-designated entity, could be an organization such as a care management organization, to complete the behavioral health HCBS assessments. So both the brief and the full assessments in order to develop the plan of care for individuals who choose not to enroll in a health home. So for these individuals, the managed care organization will contract with a health home or another state entity to complete these, both the full and the brief assessments. Then the care manager will conduct the behavioral health eligibility assessment, and if eligible, the care manager will conduct the full behavioral health HCBS assessment. So just as Alam stated in the previous workflow, the brief assessment, the eligibility assessment, can be done telephonically or face-to-face, but the full behavioral health HCBS assessment, which is the New York State Community Mental Health Assessment, needs to be done face-to-face. And again, just as Alam said, we do want to encourage that eligibility and full assessments can be done in one face-to-face meeting if desired. But that, again, is a lot of time to dedicate, so we just want to be wary of time and just bring that up during this workflow talk through. So next we have Alam, and I believe she is going to talk through box B.
Yep. So as we did with the previous workflow, we're going to zoom in a little bit into step B just to give us a more detailed concept of what it is made up of. So step B states that the MCO also contracts with the health home or another state designated entity to develop the behavioral health HCBS plan of care. And then in collaboration with the member, the care manager consults with the HCBS providers who recommend scope, duration, and frequency for these services. And then finally, the care manager completes the plan of care. Now, box B1 states that the health home care manager refers the member to the HCBS providers, now giving them as many choices that are in their network, so that way they can choose what is most convenient for them as far as location goes and possible services. So we give them the full option to choose from anyone that's in their plan of care, that's in their network. Now, the state recommends that we give everyone the ability to choose from all in-network providers, but the minimum to document in the plan of care is 2, okay? So box B2, where the adult behavioral health HCBS provider conducts their own specific assessment that will then determine the scope, duration, and frequency of those services, communicating back to the care manager with regards to what was originally documented on the plan of care, stating that yes, we're in agreement, we think that these services are definitely deemed as appropriate for this individual, and here you go on our end, here's what we're recommending as scope, duration, and frequency for these services. And then finally, the care manager incorporates that back and forth on the plan of care and comes up with the final version to pass along to the MCO, which is the next step that we're going to talk about.
Great. So I'm going to just jump back again in the workflow just to demonstrate. So the final box that we're going to talk about for this workflow is box C. And this really is about communicating and forwarding this information to the managed care organization. So in step C, the care manager forwards the behavioral health HCBS plan of care to the managed care organization. At this point in the workflow, the managed care organization is now responsible for non-behavioral health HCBS components of the fully integrated plan of care and for providing care coordination for the implementation of the individual's full plan of care, including behavioral health HCBS services. So what that step is really saying is that once the care manager forwards this completed HCBS plan of care to the MCO, the managed care organization is then responsible for the components of the fully integrated plan of care, as well as for providing care coordination for the individual. Okay. And we also did magnify step C, what I just walked through. And again, with step C, we want to emphasize that the authorization and payment processes are separate and apart from the plan of care process for the state plan services, such as physical health services and behavioral health services. And really what that is saying, just as step C in the previous workflow, is that even though all services, physical and behavioral health and HCBS, should be included in the plan of care, non-HCBS services should not be denied if they are not included. So just to emphasize that. Okay, we're going to jump ahead now. So as Alam mentioned earlier, we are going to talk through how to update the plan of care. And just as we've talked about, MCTAC has been doing a lot of trainings in the last year, and this question has actually come up quite a bit. So we just kind of wanted to walk through the process and who can and how do you update the plan of care. So with no further ado, I'm going to jump right into that. So who can initiate the update to the plan of care? Any individual receiving the adult behavioral health HCBS services can initiate an update. Also, any provider delivering adult behavioral health HCBS services can initiate an update to the plan of care. Any service provider, including primary care, behavioral health, can initiate an update to the plan of care. And this is, again, really going back to this idea of integrated care coordination. And these individuals are all working together to deliver the best care for this individual. So they all are able to initiate an update to the plan of care and can contact the care manager if they see any reason to make an update to the plan of care. And finally, the managed care organizations can also initiate an update to the plan of care. So the next little section of this slide talks about how the plan of care update is initiated. And really what's central is working with the care manager to update the plan of care. So the individuals, either the provider delivering adult behavioral health HCBS services or the individual receiving, anyone from the upper category would communicate and inform the health home care manager that they believe an update should be initiated. The care manager will determine whether a new assessment is needed. They will complete the assessment, and then the plan of care will be updated accordingly to the new assessment's results.
And so the next logical question, why would someone update the plan of care? So the individual, as they go through these services, can in fact experience, things that may warrant an update. Now, the individual on a regular basis, which is at least annually, will need to be reassessed with the New York State Community Mental Health Assessment. Now, in the event that something happens throughout that year, such as a behavioral health condition or medical condition where there was a change in that condition, or if they were hospitalized for any reason, loss of housing or change in housing situation, or let's say they successfully complete a goal and that no longer needs to be on their plan of care. Those reasons would be, and I'm sure addition to many more that we're not thinking of at the moment, can initiate an actual reassessment. And then from there, we're going to actually start to wrap up. We wanted to introduce a couple of our upcoming webinars that I'll let Meg run through. We're going to be doing this. We have 3 specific topics, one being the workflow, plan of care, and then a crosswalk of services. And she'll be able to talk to you a little bit more about where to find more information on all of those.
Thank you, Alam. That's great. So as you can see, we actually have our second installment of this webinar series starting this afternoon, talking about the different elements of the plan of care. If you are interested in any of these, again, we are recording them all. We will be posting them on the MCTAC.org website shortly. I believe the webinar we did, I think Tuesday, on this exact topic, the workflow, is already posted there. So if you go to the MCTAC.org website, MCTAC.org, you will see at the top of the website there are a bunch of different categories. If you click on events, and if you go to past events, you should be able to link up to the webinar from there. The other thing I wanted to encourage folks before we get to our Q&A section, thank you, by the way, for chatting in all of your questions, is that MCTAC also has a lot of resources and tools for providers that I just really wanted to emphasize. And for those of you who have heard me talk or present before, I probably mention this every time, but I feel very strongly about our tools that we share with everyone. So we have this one tool that's the glossary, actually. And just looking through our webinar today, you'll notice there's a lot of acronyms and a lot of different terms, and sometimes it can get a little confusing. So we created a glossary with all of the different managed care related terminology, definitions, acronyms, and it can be found on the MCTAC website under our tools. We have a variety of other tools listed there as well. So I just, again, want to encourage everyone to go there. And again, I did want to emphasize one more time that the content that we reviewed this morning, we're training on the workflow as it is today, with the knowledge that, there are ongoing conversations with the state about this workflow. And I just want to encourage everyone to familiarize yourself with the MCTAC website, as well as to sign up for our listserv. If there's any updates to this workflow or anything else related to HCBS or managed care, MCTAC is very diligent about posting those updates, both on our website as well as sending out updates to our email listserv. So I just wanted to encourage everyone to sign up for that. And I think I'm going to just go to the last slide. So again, this is our website. This is our email address. It can be found at the bottom. If you do have any questions related to managed care, you can feel free to email them in there. And with that, I think we're going to go through, Alam and I have some questions that have been chatted in. We're going to try and go through some. I do believe we have one of our state partners on the phone. So if you, Joe, want to unmute yourself, this would be a great time to jump in for our question and answer. I think Alam and I are pretty comfortable with these answers, so we're going to read the question, Joe, and then if you maybe want to try and give it a go at answering, that would be wonderful. Does that sound good?
Excuse me. Yeah, I'm fine with that. Or really here more as support, and if you guys need any assistance. So why don't we just sort of tag team them, and we'll see where we go.
That sounds fabulous. Thanks, Joe.
Okay, so the first question that we have is actually regarding all of the HARP services. Assessments, hold on, let me make sure I'm reading this correctly. Okay, my question regarding all of the HARP services, assessments, is how this is supposed to be billed. And our understanding is that there is a rate sheet on the OMH website that provides the codes and rates for all of the HCBS services, including assessments. Is that right? I believe that's right.
I think that's Joe, can you confirm is the code and rate sheet up on the OMH website?
Yes, it is.
Great.
Okay. It should be under the HCBS listings.
Wonderful. Okay. So our next question, just to be clear, is it is the HCBS provider that determines the scope, duration, and frequency in the plan of care, not the health home care manager. Great question. So it is the health home care manager in collaboration with the HCBS provider and the member, remember that spirit of person-centered client choice, that determines the scope, duration, and frequency of the services. So again, if you just want to think about it as this trifecta of individuals, there's three people that really work together in collaboration to determine the scope, duration, and frequency of the services.
Yeah, and the provider, the care manager may have some basic understanding and make some recommendations to the person, but when you get right down to it, the provider of the actual service is the one who really will understand that service the best and working with the individual to determine how much duration and scope is really needed.
Mm-hmm.
All right, thank you.
Great, thanks. Okay. So the next question is, how do you get authorization? Actually, we have a forthcoming presentation on utilization management, which I recommend that you visit the MCTAC website for more information on. It has not been announced yet, but that date is forthcoming, so please stay tuned for that. Okay.
Okay, so now we have a question about timelines. This question is, what are the timelines expected between the time of initial contact to conduct the assessment, the health home completing the plan of care, and then sending it back to the MCO, which will then send it back to the health home? So that's a great question. We are still, I think this actually came up as well during our in-person plan of care training earlier in October. We are still following up with this. So Joe, I don't know if we have any clarity around this yet. My understanding was that clarity and confirmation will be forthcoming. Is that correct?
That is correct, yes.
Okay.
Okay. So the next question that we have here is, which is a great question actually, must the brief, screening, and full assessment be completed by the same person? Not necessarily, although it is recommended that the same individual do complete both assessments, but it could be completed by different individuals.
Okay. So the next question we got chatted in is the behavioral health HCBS assessment the same as the UAS assessment? And I can confidently say no, that the UAS assessment is utilized in the MLTC, the Managed Long-Term Care setting, and it is separate and apart from the HCBS assessment. So just to emphasize that.
And the next question is, if the care coordinator conducts the first eligibility assessment and seems that the client is not eligible to move forward, then what does the care coordinator need to do, especially when these clients have been flagged as HARP eligible by the state? Plain and simple answer is just notify the MCO. Make sure that they're in the loop with everything, every step that you're taking, so that way they can actually, in collaboration, help move this client along and get them into the necessary place where they need to go. So if, in fact, that is the scenario, just let the MCO know.
And the other thing to remember is that all of the HARP-eligible individuals still have access to all of the mainstream state plan services that they would have had if they were not on HARP. So these HCBS services are simply additive to the full array of services that they have. So even if the assessment says they're not eligible for these services, there's still a wide array of services, and you can work with the MCO, excuse me, and their care coordinators to try to figure out a plan of care that makes sense without these additive services.
Great. Thank you for adding that, Joe. So we actually have gotten quite a few questions about billing, and someone asked if we could discuss how billing is part of the workflow. And what we want to do is really refer people to the billing manual and rate sheets that we referenced earlier that are posted on the OMH website under HCBS. Joe, is that kind of like the best place to direct people to if they have billing questions?
Yeah, that's really our main resource on that.
Okay. Thank you.
That and the plans themselves, so you can also go to the plans.
Thank you.
Okay. Next question. What happens when the plan of care isn't updated accordingly after each hospitalization or when the client experiences housing issues? That's definitely something that if the potential that the needed services are not identified on the plan of care, then the individual would not be eligible to receive those services. So it's really important to emphasize that any significant experience that the client is going through, which entails an update or a reassessment, that this in fact does get done so that way the proper services are reflected in the final plan of care.
Okay. And our last question that we're going to go over today is, where will the care manager find a list of in-network providers? We want to encourage you to contact the managed care organization. OASIS and OMH also has a list of designated HCBS providers on the website. However, those are not organized by plan. So if you want to look at a list of in-network providers, go directly to the managed care organization, and they should be able to tell you who they have contracts with and who is in their network. Okay?
Yep, so those are the questions that we have so far. We do have a handful more, but what we're going to do is compile all these questions and make sure that we get you thorough answers to hopefully provide some more guidance, in addition with collaborating with the state to get to make sure that we get the right information to you. I want to encourage you guys to really visit the MCTAC.org website. There's so many resources on there. I know a lot of people may have tuned in a little bit later. If you didn't catch this webinar from the beginning, it will be available on the MCTAC website for your review. So please feel free to do that. You can access the slides and the recording as well. And if you have any additional questions, you can feel free to send it to the MCTAC email that's actually listed on the slide there at the bottom, at mctac.info@nyu.edu. And Meg, is there any other closing comments that we need?
For those of you who are joining us this afternoon for our Plan of Care Elements webinar, we will see you. We will talk to you then. And for everyone else, have a great rest of your day.
Thank you so much.